do you see using MSC, modified citrus pectin, at all? Do you use this at all? I'm specifically interested in it as a binder before SIBO treatments to ameliorate die-off symptoms, as I'm sensitive to coconut charcoal. Modified citrus pectin seems to give me bloating and gas, but I'm not sure what else I could use, as I'm a very sensitive patient. I just want to just say one thing here is that Dr. Siebecker, you've treated thousands of people without binders, right? Successfully.
I don't use binders.
Right.
Well, I mean, charcoal's a binder, of course. So yes,
Right.
I guess I use it, but I'm not using it in the traditional mold sense of a binder. But yes, charcoal's a binder, and it's true. It is that function for die-off. It is. It's absorbing, adsorbing, binding the die-off metabolites and such. So yes, in that regard, I do, but I don't use them. I only use them when they're needed. I use them for symptomatic control, but in this case, it's needed, right? So,
well, I don't know. Do you have die-off symptoms, Winnie? Because you can pop into the Q&A box, because I know you're here.
she said she's very sensitive. So I'm assuming that means that she has experienced die-off commonly and is anticipating getting die-off.
In the Facebook group, Allison, there's been this huge wave of people thinking that binders are essential for SIBO treatment. So I'm just trying. Well, it's kind of trendy.
Where's that coming from?
Oh, it's coming from binder manufacturers, and that's
I'm like, oh, that's because that's nothing we only just use it if someone has die-offs, and it meaning charcoal.
Right. Yeah. So
I mean, the only other place I could think is just because there's been so much awareness raising of mold being a potential, sometimes, underlying cause of SIBO, and binders are used to manage mold, but not everybody with SIBO has mold. It's just super complex, complicated cases. We often find that's the issue. Back to the question. Now, I thought we talked about this in another one, that I thought there are sources of charcoal that are not coming from she said coconut shells, right?
Yeah, there's some bamboo, I think.
Yeah, I know there's bamboo. There's bamboo. I used to know the name of that product. Will it come to my brain? Probably not.
You can Google it. It's super easy.
And also you can go on, like, if you have, Lena wrote it, Takesumi Supreme. That's exactly it. Thank you, Lena.
Thank you.
It's in the chat. So that's from bamboo. And then I think there's even a third source of charcoal, but I can't recall it right now. And so back to the idea of the modified citrus pectin. I've never actually used it for any of my patients, but like where I have asked them to take it. But I have heard from people who are taking it for mold, for SIBO, and some people tolerate it and some people don't, because it's a prebiotic, it's highly fermentable, and it just bothers people. I think she said it bothers her. So